I decided to become a pediatric orthopedic surgeon for a lot of reasons, actually, and it starts pretty far back. I was 19 years old and went on a mission for my church to Brazil. So I saw a lot of kids with clubfoot and fractures of their forearms that had healed in odd ways, and just kind of thought, man, it'd be pretty cool to be able to help those kids out.
So scoliosis is something that affects both boys and girls. We tend to see and treat more girls, I think, than we do boys. I think he really wants to be able to tell these girls, like, I did it, and this was my experience.
I thought it was really cool when I heard that he was going to wear a brace for 18 hours a day for a week, because he really wants to know what his patients go through, and that's really cool to me.
For Molly specifically, she has what we call idiopathic scoliosis. It's the most common form of scoliosis to have.
One thing that I've noticed when he has to have that it's time to begin bracing treatment talk with patients is, we'll come out of the room and they're crying, and he'll look at me and say, was that okay? Was I compassionate enough? And he's always worried about that. So I think it probably stemmed from that.
I feel like I am a bit of a fraud when it comes to talking to these kids about what it's like to go through brace treatment. So if I took a bit of a cue from these really brave older surgeons and doctors who are willing to do things themselves, then maybe we could do that with a brace. When I went to pick up the brace, I was excited and I was curious, a little intimidated. Movement in general is different from what I kind of expected. It's a little, maybe more restricting than what I thought it was going to be.
Dr. Riley is one of the best physicians that I've ever encountered. I think he sees his patients as more than just patients. I think that he sees them for who they are, and he sees their families, and he takes all of that into account when deciding what their care should be.
I'd say I'm committed to care because when I got into medicine, I wanted to make people feel better.